Now, shifting gears, South Korea is now just days away from the start of what authorities are calling living with COVID-19. Authorities said Wednesday that they're currently drafting a comprehensive plan so the nation can return to normal routines closely resembling those we enjoyed before the pandemic. But first, it's critical that infection numbers remain low and vaccination numbers high. Now, to answer some of the questions about latest coronavirus developments, joining us in our studio is our COVID-19 correspondent, Kim Yeon-seung. Welcome, Yeon-seung.
Thank you for having me.
Now, let's start with the COVID-19 infection situation for today. Can you tell us more on that?
Yes, so what the nation is seeing right now is a mild wave of ups and downs among COVID-19 infections. So South Korea on Thursday reported 1,441 new cases. Although this figure is about 400 cases higher than what we've seen early in the week, it's actually the lowest tally that the country has seen on a Thursday in 14 weeks. So Thursday's tally blends into an overall downward trend that the country has been seeing lately. What stands out as noteworthy from recent cases, however, is the high proportion of Delta cases among local infections. Health authorities identified close to 3,400 variant cases last week, and all but 3 of them were the highly contagious Delta strain. But these 3 were imported cases, so among local infections, 100% of them were Delta.
Right. Now, Yeon-seung, what about the vaccination front? How are we doing in the vaccination campaign?
Well, South Korean top health officials said that the country will soon reach 70% in inoculations. And this milestone is important as it is seen as a precondition for the resumption of normal life. Now, South Korea's vaccination rate reported on Thursday stands at 67.4%. And with this momentum, there's a good chance the vaccination rate might even reach 80% by next month. But along with an increase in vaccinations, there has also been a climb in breakthrough cases. 1 out of 4 people tested positive in the first week of October, and they were actually fully vaccinated individuals. Johnson & Johnson recipients in South Korea saw one of the highest rates of breakthrough infections. It was 5 times that seen in Pfizer recipients and close to 40 times found with people jabbed with the Moderna vaccine.
Now, Yeon-seung, speaking of Johnson & Johnson, we earlier talked about the U.S. working to approve booster shots for those people who've got vaccinated with the Johnson & Johnson vaccine. How is that decision coming along?
Well, the U.S. FDA also just authorized booster shots for people who've had not only the Johnson & Johnson shot, but also the Moderna shots. But what's different about the Johnson & Johnson shot, however, is that recipients can get the booster just 2 months after their latest shot if they are aged 18 and over. For Moderna and Pfizer recipients, only people 65 or over, or those who are considered high risk, can get the shot. And it's recommended that they get a booster at least 6 months after the final shot of the 2-round vaccination. The agency is also allowing a mix and match approach where people can get a different type of jab from the one they originally had. This expands the U.S. booster campaign to include tens of millions more people and gives more flexibility to health services.
Then, aside from booster shots, are there any other efforts the U.S. is making to expand its vaccination?
Right, absolutely. The Biden administration is currently planning to vaccinate millions of children aged 5 to 11. U.S. officials on Wednesday outlined a plan for vaccinating children, and they said that they've already acquired enough vaccines for roughly 28 million kids. Part of that plan involves inoculating children in pediatric offices to provide a more comfortable environment for the children when they get their jabs. Anthony Fauci, the nation's top infectious disease specialist, says this step is a critical step in curbing the spread. The U.S. Centers for Disease Control and Prevention is expected to announce its decision sometime in November.
Okay, thank you, Yeon-seung, for your report. We will talk to you again tomorrow morning.
Looking forward to it.